The views expressed on the following program do not necessarily reflect the views of Money Radio staff, management, or advertisers, and do not represent an offer to buy or sell any securities. Some interviews heard on this program may be sponsored by the participants. It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and it must be Friday, and indeed it is. It is Friday, December 17th. We're coming at you live from the Scottsdale Air Park studios of Money Radio, 1510 AM, 105.3 FM, and the World Wide Web, moneyradio1510.com. If you are just tuning in to the show for the very first time, our show is about how our older adult population can live a healthier, happier life. How do we do that? We do that by bringing great guests to the show. People don't come to listen to me. They come to listen to our guests, and today is no different. I've got a studio full of people that you want to hear from. So I am proud to have in my studio for the first time in almost 7 years, I have Jewish Family and Children's Service here. I've got Dr. Lori Henderson. He's the president and CEO. And I've got Mary Jo Whitfield, and she is the VP of Integrated Health. And I've got Gail Bear, the VP of Philanthropic Services. Philanthropic Services. Oh, gosh, I'll tell you what. Must be the end of the year. It's hard to believe we got 2 more shows before we close out 2021. But I am really glad to have Jewish Family and Children's Service here. It's a social service organization that is very near and dear to my family's heart. We've been benefactors to them for many, many years, and I would love to kick it off, and I'm going to look at Dr. Lori Henderson. Can I call you Lori?
Lori's great.
Perfect. Lori, tell me a little bit about Jewish Family and Children's Service.
Well, thank you for having us. Jewish Family and Children's Service is a nonprofit organization that started here in the Valley approximately 1935.
1935. That is correct. 86 years old.
86 years old. I'm not 86 years old.
No, but
sometimes I feel like it, but I'm not. We're a mission-driven organization, and our mission is to strengthen the community through behavioral health and healthcare and social services. And we provide these services through a number of locations throughout the Valley. And I can take you through, we have a vision statement, and we have organizational values, and we have Jewish values. So our organizational values, our top priority is quality service. And our most important resource is people, both our staff and those that we serve. We value cultural competency, diversity, fiscal responsibility. We have a commitment to excellence and continuous improvement, collaboration, and communication. So those are kind of the things that we try to focus on in fulfilling our mission. And I'm going to ask Gail Bayer, who's our VP of Philanthropic Services, because she can do the Hebrew and the English version of our Jewish values, and they're really important to us.
Thank you. Yeah, so what's beautiful about JFCS is that since our founding in 1935, we have retained the Jewish values of our organization, even though we serve all folks of all races, religions, age, what have you. So our Jewish values are kahila, and that is means building community. Tzedakah, and that means to do what is just and right. Tikkun olam means to repair the world, and we feel that at JFCS we have a big role in that. And then finally, Gimilut Chasadim is acts of kindness and compassion, and all of those values permeate throughout our agency, at all of our locations and with our service providers.
And certainly it drives your mission. And I think one of the things that is really misleading is, while the foundation has such a Jewish, deeply rooted foundation, Lori, you brought it up, and Gail, you also said it. I mean, you serve the community at large. It's not just for Jewish folks. As a matter of fact, I think over 90% of the people that you serve are not Jewish, correct?
Correct, and I'm glad you brought that up because that's really important. Though the name is Jewish Family and Children's Service, but just like Catholic Social Service or Lutheran Social Service, there's not any kind of discrimination. As a matter of fact, we really pride ourselves in serving everybody of need in the community. And we also, if you ever look on our website, we have a promise, and that is to serve all clients. We offer discount to any client that can qualify, but we do not discriminate based on race, disability, color, religion, gender, sexual orientation, national origin, nothing. So we really serve everybody, and that's important to us.
No, it definitely is. And really, you're deeply rooted, and Lori, you brought this up at the beginning, in the behavioral health sector, if you would. And, I know that our first segment goes by, all the segments go by really fast, but I can't imagine how trying these last 2 years have been. 22 months, however long it's been with COVID. Not only on the workforce you have, I know you have a really deep roster of clinicians and social workers and team members that work for you. So not only those challenges, but challenges relating to serving the community at large.
Absolutely. There's been, COVID has changed the world, and it's changed our world, and we're still adjusting to what that really means. But we've adapted the best we can. I think like most organizations, we struggle with the labor market right now, and there's hesitancy for people to go into homes and be with clients and be around others at the workplace. And so we're always looking for good workers and good employees, and we struggle with that right now. But we've innovated in quite a few ways where we've made this adaptation to more telehealth services. So telehealth and telebehavioral health, and that is the ability to do these virtual services where we can do it over the phone, we can do it over Zoom, we can do it in different ways other than just in person. Now, we still have all our in-person, but in addition now, I think we're doing somewhere north of 3,000 telehealth or virtual services monthly, and then about another 10,000 in our children, family,
Wow.
and older adult services.
Those numbers are staggering. And I know this about JFCS. You guys already were innovative. You guys were doing a lot of this stuff already. So it wasn't like a lot of organizations that had to pick themselves up by the bootstraps and really figure out how to serve their community or serve their patient base. You were already doing some of this.
And luckily we were, because we really, had some of that infrastructure in place. We were already kind of going that way. And we were able to just rapidly kind of really increase our infrastructure and then put those systems in place to be able to continue to serve as many as we can. And fortunately, we were able to do that. We continued to be able to serve somewhere over 40,000 separate individuals, children, family in a year.
40,000, and my math tells me with telehealth visits as well as visits in person, that's about 180,000 visits that you're able to do on an annualized basis. That's pretty incredible.
And it's a lot of the individuals we see, well, most all of the individuals we see are of the neediest in the valley. So there was a point a year or two ago where the stat was around 90-95% are at or below the poverty line. So these are the neediest individuals there are, not just financially, but with the conditions that they have,
Sure.
different mental health conditions. So we'll see somebody that's 40,000 unique individuals, but we see some of them 10, 20, 30 or more times. So it's really a big number.
No, it is, and certainly we can dive a little deeper into this in the second segment, and we are going to hear from Mary Joy Whitfield, and she's being really quiet over there. But I want to talk a little bit about your on-ground locations, because you have medical facilities throughout the valley. So when we come back in the second segment, let's talk a little bit about that, and really, this population that you're serving, the neediest of need, social determinants of health that we have, and food insecurities and other insecurities that exist. You guys see that every day. So I'm excited. We got 3 more segments. Stick around. We've got JFCS here in the studio. I've got Dr. Lori Henderson, Mary Jo Whitfield, and Gail Baer. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and if you're just tuning in, we're in our second segment here. And I've got Jewish Family and Children's Service here. If you haven't heard this yet, we got Dr. Lori Henderson. He's the president and CEO. I got Mary Jo Whitfield. She is the VP of Integrated Health. And I've got Gail Baer, the VP of Philanthropic Services. Why am I having a hard time with that? Well, in any case, if you missed that first segment, go up to our website at cypresshomecare.com. Click on the media button, third button down as radio show. You'll be able to catch this show and many, many more. In that first segment, Lori did a great job of really, painting a picture of what Jewish Family and Children's Service is all about. 86 years old, born in 1935, and they serve the public at large, not just Jewish folks. They really help people with behavioral health, healthcare, and social services. Those are really the sectors of healthcare and social services that they're in. We did talk a little bit about, the pandemic and the innovation that already JFCS had already adopted with telehealth visits, and was able to do more of that and stay connected. And we really were talking in between the break that, the real pandemic that really happened was people weren't getting care. And that was really a challenge for anyone that is dealing with healthcare issues, but even more so people that are dealing with behavioral health issues. And Mary Jo, I want to punt it over to you using the football metaphor since we're in the football season. Right. But I really want to punt it over to you and really talk a little bit about what has happened now and what the future looks like. I also teed it up in the first segment saying you had medical center locations throughout the valley, and if you could share that with our listeners, that would be great.
We, in addition to having our integrated our behavioral health clinics, we also have primary care located in all 4 of our outpatient clinics. They're located throughout Maricopa County. We have one in the East Valley, one in Glendale, one close to the 101 in McDowell, and then we have one in Maryvale. So as Dr. Henderson said earlier, we do serve the neediest people. And I like to say to the staff that if we're not going to take care of them, there's probably nobody else that's going to. So we kind of pride ourselves on that. The ability to go to virtual visits was a really big godsend for us. We already had the infrastructure. We were able to, within a very short period of time, like 30 to 45 days, really get up and running and get our virtual visits established because we had that already. So we were really fortunate in that area. One of the things that we did find, however, is that a lot of our membership, a lot of the people we serve, did not have access to the technology that they needed in order to be able to benefit from that. So through the good graces of our philanthropic services folks, they've been fundraising for us, and we've been able to bring some equipment in and wireless capability that we're able to disseminate to our members so that they can benefit from a virtual visit. And it has made the difference in terms of access to service for a huge number of our members. We serve everybody, so we like to say we can can take care of you from the womb to the tomb. So we have a lot of really little children. We have young families. We have teenagers. We have adults. And then we have our older adult population. And as you know, our older adult population often has multiple healthcare issues in addition to their mental health issues. Being able to see them virtually has meant the difference between them really deteriorating because they've been alone and being able to have a constant contact with the outside world. So while we were able to keep them safe and not expose them to any unneeded possibility of infection from the virus or anything else for that matter. So in the same thing for our younger families and children, being able to see them virtually has also made a big difference there. So we're doing everything we can to keep providing those services. And in addition to that, I know earlier you mentioned social determinants of health. And for those of you who don't know what that is, it is a meaning that we're not just serving people's mental health issues or their medical issues, but we're also, we know that if you're have unstable housing, insufficient transportation, or you're really hanging on economically, mental health treatment is a luxury. It's not a necessity in those situations because people need to feed themselves and take care of their primary needs before they can take advantage of anything else.
It's about survival.
Be able to, yeah. So again, because of our wonderful philanthropic services people, we have food pantries in all of our clinics that are constantly being resupplied through our Just Three Things program.
I love it.
And so we have again been able to. We've received a number of really important gifts from our donors to help with unmet needs. Things like being able to help people pay their rent, being able to keep the lights on. And then again, with the ability to do virtual services, we don't have to worry as much about transportation. So we've seen a really huge increase in our show rate for things like medical appointments, doctor appointments, significant, like 25%.
Wow.
Over the last couple of years. So even though this has been an exceedingly unpleasant time, it's also, there's been some really good things that have come out of it.
It really restores your faith in,
Yes.
faith in humanity.
Yeah,
The fact that, we have so many people in our community that give. And, Gail heads up the philanthropic effort, but I mean, it really takes a village, and this village really steps up.
And this village really
helps.
has stepped up.
Nice. And I mean, we talk about social determinants of health, and food insecurity is probably one of the biggest. And the fact that you have these food pantries is huge, because oftentimes we have older adults and people that are dealing with other health issues who sacrifice food to get their medications, or vice versa.
Or they'll only take part of a medication, or every month they make a decision about which prescription they want to get filled. We are able to also cover those things to a certain extent. And again, it's because of the generosity of our donor population and our community.
So as we wind down the second segment, I'm going to ask you to explain to our listeners what the terminology means, what the terminology is behind integrated health.
Okay. Integrated health means that you can get all of your health care in one place. And when we talk about health care, we believe that it's not just treating your major depression, but it's also treating your high blood pressure in the same place. And because we have those providers under one roof in our clinics, you don't have to go to 6 different locations in order to get those services. You can get them all in the same place. And if you need to, you can get them on the same day. Sometimes, people don't want to do that, but if they want to, it's possible. So we're also able to make sure that their medication is delivered to them if that's necessary. We have a great pharmacy partner who does home delivery, and again, we're thinking about access to care. Access to care is a huge issue in Maricopa County because it's bigger than Rhode Island. So. And our transportation sometimes is not what we would like it to be. So, and we have people who are not don't have stable transportation. So these are all really important factors in serving our populations.
And the concept behind integrated health too is, it kind of epitomizes that mind, body, and spirit, right?
Mm-hmm.
So that the clinicians in your medical centers or healthcare centers are able to really have the full picture of
Yes.
somebody's health,
Right.
and you're not just treating one part of it; you're
No.
treating all of it.
No, and actually we use the same medical records. So our PCP notes are in the same record as our mental health notes. So, and they're in the same building, and if it's necessary to huddle up and address a particularly urgent need on the behalf of a family or an individual that we're treating, people can get together and have that discussion without having to go through email or try to make phone calls and play telephone tag. So it really does help to improve the overall care of the person that's being treated.
Indeed. We talked about the medical centers, and the one in Maryville is named for the previous
Yeah.
CEO and president, and my friend, Dr. Michael Zent.
Mine also.
And it's, what a great loss
Yeah.
for the organization, and what a great way to keep his memory alive, and having that building and that establishment named for him. It's hard to believe we're here at halftime, and we've covered a lot, but I want to give a shameless plug. If you want to learn more about Jewish Family and Children's Service, go to jfcsaz.org or call 602-279-7655. And you want to go to those sites if you're needing services or know someone needs services, but if you want to donate, there's a big yellow button up there, and I know Gail Barrow will come back and talk a little bit about that in the second half. We're at halftime here. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. And if you're just tuning in, we're in the second half here, and I've got Jewish Family and Children's Service here in the studio. I've got Dr. Lori Henderson. He's the president and CEO. I've got Mary Jo Whitfield. She is the VP of Integrated Health. And I've got Gail Barrow. She's the VP of Philanthropic Services. And we have talked about Jewish Family and Children's Service in that first half, and we talked about a lot of things about the services that they offer. We talked about how they did through this pandemic, and we've talked about some of the things that they are doing that is really innovative to really help care for our population here that is challenged with behavioral health issues, if you would, for lack of a better word. If you want to catch that first half, go up to our website at cypresshomecare.com. Click on the media button, third button down is radio show. You'll catch this one and many, many more. So I really want to talk about something that Lori, that you talked about, and Mary Jo, you talked about it as well, is really the community response and how they really stepped up and really helped in so many ways. And Mary Jo, you talked about the food insecurities and the food pantries that are in the medical centers. Maybe this might be an opportunity for you to talk a little bit about, Gail. So talk about this community response and how they have stepped up.
Yeah, well, let me just first say that the community really responded, and not just at the onset of the emergency, but throughout, and has continued. There were a couple of changes that we made very quickly because of necessity. The first thing we did is we established an emergency fund, because we didn't know what we didn't know yet. And so, but we did know that there was going to be a lot of need. We knew that it was going to probably be deep, and we knew that it was probably going to be ongoing. And we're still seeing that. So we established an emergency fund, and the community responded really beautifully. And what that enabled JFCS to do is to provide a lot of flexibility to respond to things quickly, no matter what the emergency was. And sometimes it was housing, sometimes it was electricity, sometimes it was an emergent medical need that needed addressing. The other thing that we saw very quickly throughout that first spring, summer is that the food insecurity issue really just accelerated and permeated throughout all of our programs and services. So before the pandemic, we had our Just Three Things food pantry in one of our healthcare centers, as well as a program site that largely serves youth aging out of foster care. So what we did very quickly is we just expanded it to all of our program and healthcare center locations, because the pandemic, as you know, really didn't know any zip code. And what we found was that as soon as those supplies went in was as quickly as those supplies went out. And we thought maybe this was sort of a temporary situation, but even as we're sitting here now 22 months later, those food pantries are still in place at all of our locations, and the same situation, as soon as it's filled up is as soon as it goes out, and the cycle keeps on going.
Right.
And that is, and thank goodness that we have a community response to that, and that we're able to keep replenishing, because the needs just still exists. So
And it really hasn't waned at all, has it?
No, actually, it's getting worse.
That's a scary thing.
Yeah.
It really is.
Yeah.
And you guys are a treasured gift for our community to be able to help this population, that is less fortunate, and you're able to step up and do that.
yeah, and I mean, the other thing that I think was a bit of a shock to the system on our end, especially my colleagues and I who are focused on the philanthropy component of JFCS, is that there was no boundaries to the virus. And we found over and over, we would get calls, my staff would get calls, that it was the donors, the people that are usually helping us, that needed help.
Whoa.
Serious help. So that was it just sort of underscored the importance of JFCS services to everyone, and fortunately we were there to provide that assistance.
So I know that JFCS relies so much on philanthropy, and Gail, you help lead that charge, and I know that you have an event that's coming up in a month.
We do.
And,
yes.
Please, share that with our
Yes.
listeners, and also we do have the tax credit too. I would love for you to share that.
Great.
While
Yes.
you got the microphone.
Sure. So we have an annual fundraising event, community event. It's coming up on January 28th. It's our Brighter Tomorrow event. We usually do have a luncheon style format, but this year, as we did last year, it's going to be in a virtual setting. We have a featured speaker this year is Mayor Kate Gallego, the mayor of the city of Phoenix, and we're thrilled and honored that she'll be able to participate. She's been a great supporter of the work that we do, and especially given our huge footprint in the city of Phoenix. So we're delighted to have her, and you can register for that on our website at jfcsaz.org. And it's a very minimal registration fee of $36 to be able to join that. And then the other exciting thing this time of year especially is that JFCS is a qualified charitable organization for the Arizona Charitable Tax Credit, which is a real gift, honestly, to those of us who pay taxes in Arizona, because we are able to direct up to $400 as an individual, or up to $800 if you are filing jointly, to a qualified charitable organization of your choice. And it is actually a tax credit, so the math is actually better than a deduction. And we're very grateful to receive a lot of those funds, and that also gives us tremendous flexibility to fill gaps, as my colleagues have discussed before.
And as I said on the website, there's a big yellow button up on the top right that says donate, so you can find that there. So philanthropy is a great way that you're able to fund the work that you're doing for so many in our community. But, Lori, I'm going to punt it over to you, and so much is really done through the advocacy work that you do with our state. And I know you receive a lot of funds from the state, and is there anything you can share with us, any help that we as a community can provide JFCS and this population, and really talking to our legislators and really saying, hey, guys and gals, we need more appropriations to really help care for our healthcare challenged, behavioral healthcare challenged individuals?
Yeah, thank you. We really, for the most part, 50% of what we do is behavioral health. About 25% of what we do is child and family services, and within that, we have domestic violence. We have one of the largest domestic violence shelters in the state. We have our older adult services and our Jewish community services. So there's a lot of services to fund, and there's limited funding for all of these. So we really survive to a great extent by our supporters and donations. But even within the services that we provide, where we do have funding, the funding's not enough to keep up with the need and to even cover all the costs. So that's why there's such an emphasis on the fundraising all the time. So yeah, we really actually need to, and we're working with our state trade organization, so to speak, to really push for some rate increases, because I don't think we've had a substantial rate increase since like 2008. So not a lot of businesses can go that long without a rate increase, because as we all know, there's inflation and cost of living and everything else that goes up. And now with the struggle with the labor market too, we've got difficulties. So we really need to have anyone and everyone that is familiar with our services or supports our services to help with that. And like I said, we're going to work with our state association to really move that along.
And I can totally relate. We're an Altex provider serving the Access community, and to give you an example, I mean, we're incurring a increase in minimum wage, and our rate increase is half of what that minimum wage increase is. So, we really all need to work together and make sure that our legislators know the need is great. Well, you hear the music. We're down 3 segments. We got one more to go. Stick around. I got Jewish Family and Children's Service here. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. Way to go, James. Little Marshall Tucker taking us out. Love it. We're in our 4th segment. If you're just tuning in, I've got Jewish Family and Children's Service right here in the studio at Money Radio Air Park Studios. I've got Dr. Lori Henderson. He's the president and CEO. I've got Mary Jo Whitfield. She's the VP of Integrated Services. And I've got Gail Baer. She's the VP of Philanthropic Services. And if you missed the first 3 segments, go up to our website at cypresshomecare.com. Click on the media button. 3rd button down is radio show. We really talked a lot about in the 3rd segment, really how the community's responded to Jewish Family and Children's Services needs, both public and private funding, and Gail walked us through that. And I want to make sure we get this in before we close out this segment here. Gail, how do they find out more about how, our audience on how they can donate? And you have a big event coming up. Can you repeat that with our audience?
So we have our annual Brighter Tomorrow virtual event coming up on January 28th. It's at noon to 12:45. And our featured speaker is Phoenix Mayor Kate Gallego. And you can go to our website at jfcsaz.org to register for that. And if you're looking to make an annual gift to JFCS, and this is also a good time to take advantage of the Arizona Charitable Tax Credit, you can go to our website. Again, it's jfcsaz.org, and there's a big yellow button on the top that says donate, and it will direct you from there.
Fantastic. So we got 2 more weeks before we close out 2021, and we're going to get ready for 2022. And I'm looking at you, Lori, who's the president and CEO. What is in store for the future for JFCS? What do you see in 2022 and beyond?
So we really pride ourselves in this 86 years that we've been around in the Valley, and we look forward to another 86 years. Challenges are different. Every year we've had significant challenges. They're just different.
Right.
We didn't expect COVID, right? So between all the different challenges. We want to continue to provide the highest quality services. But we're going to look to continue our virtual services, and not just continue them, but expand them. We really want to make that kind of the biggest core of what we do, just because it eliminates the two biggest barriers that our clients have, which is childcare and transportation.
Nice.
And so if we can help make that a lot easier for them, there's less misappointments. They have less challenges because they are able to continue with their medication, be able to see their primary care provider, and it makes a big difference in all of their lives. And it's just a lot more efficient. So we're just happy it's kind of gone that way.
It also give you a chance to reach more people too, doing it virtually.
It does, definitely does. So, really the short answer is just to continue to provide the highest quality services, and really we're always fine-tuning to make sure that we're providing evidence-based practices and best practices that are the most efficient and efficacious for those that we serve. So we're looking forward to another long future and another 86 years of providing services to everybody that needs it.
Love it. Absolutely love it. Mary Jo, you're on the front line. You see what's going on every single day, being the VP of Integrated Health. What do you see in 2022 and beyond?
I think that I would agree with Dr. Henderson. We are very focused on solidifying our hybrid model so that we can see people virtually whenever it makes sense clinically, but also be able to see them in person, because we haven't figured out how to give people injections virtually yet. So when children need their child visits and their shots, we kind of have to see them. I'm sure they wish we wouldn't, but in order to accommodate the multiple needs of the populations that we serve, we are going to, we're really going to work on solidifying our hybrid model. It'll never go back to the way it used to be. It shouldn't.
No, it shouldn't. But what's nice that you shared with us before is the locations you have throughout the valley, because you really do cover all of Maricopa County.
Yeah, we do. And we've been very fortunate in being able to do that.
And when you think about it, for our listeners, there are 4.6 million people that live here in Maricopa County. It's a huge number. I've heard it referred to as the largest suburb in U.S.
It kind of is.
And not only that, I mean, I'm a provider of care services for older adults, and nearly 1 million of those are 65 and older.
Right.
So I mean, we've got a lot of work to do.
Right.
So Gail, 2022 beyond. I mean, your arm of JFCS is so important. Lori talked about how we really needed the philanthropic services to really help through this time, and you shared some of those things. What do you see for 2022?
Well, two things come to mind, and the first dovetails on some of the things that we continually do at JFCS, and that's just continue to be innovative. And even as we're innovative in providing services, we're also innovative in philanthropy, and being able to respond to the needs of the time and what's going on, and reacting quickly and responding quickly. We will continue to do that. We ramped that up, obviously, over the past 22 months, and I don't see that changing. And the other thing I think that has benefited us actually is working more closely with community partners in the philanthropic world to be able to achieve our collective goals. And it's not that we didn't do that before, but given our situation, we have kind of more of a collective community response, and that's benefited all of us to a great degree. And I think that we should be continuing that in that realm.
Absolutely. And I know that you guys were the beneficiary of a grant that came through the Virginia Piper Foundation.
Yes.
And I'm on the board for an organization that we just recently had here, Duet. They were beneficiary too. Can you share with our listeners what that meant to you?
Yes.
And what a gift that we have here in our community.
Yes. So we've actually worked with the Piper Trust for a number of years, and they have provided funding to JFCS for various projects and programs for a very long time. But back in, I guess it was just middle of September or so, Dr. Henderson and I were notified that we to go to their office at a certain day and time, and unbeknownst to us, when we met with a couple of the trustees, and they presented us with a $2 million check, unrestricted, and it was just really a surprise and a blessing. And the trustees of the Piper Trust did that because they saw significant growth in their holdings through the pandemic, and they felt that rather than hang on to it, they would distribute the entire growth that they realized in that during that single day. And it was really quite something. I don't think I'll ever forget that day in my career as long as I live.
What a great gift that is to JFCS, but what a great gift in our community, because all the not-for-profits that they were supporting were all struggling, including the one that I am on the board of. Great group that we have here to be supporting our community. So as we wind down, we've got maybe 30, 45 seconds. Is there a question I haven't asked? Anything you want to share with our listeners as we get ready to sign off?
Not that I can think of. I mean, what I always want to do is make sure that everybody that is a supporter of JFCS knows how thankful we are for all of the support through the year. We get just incredible support, donations, volunteers, just all kinds of support in different ways, and that makes all the difference for us to be able to serve those that we serve. So that's probably the message I'd like to leave with.
Big thank you.
Yep.
And thank you, Dr. Lori Henderson, and thank you, Mary Jo Whitfield, and thank you, Gail Baer, for donning our studio.
Our pleasure.
And sharing with our listeners this incredible organization that is 86 years old. And as Dr. Lori Henderson said, we want JFCS to be around for another 86 years. You've been listening to Health Futures Taking Stock in You. Make it a great day. Have a great weekend. We'll be back next Friday.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.